We all know that diet, disease, and emotional stress can disrupt the proper functioning of the digestive system. So we really need to maintain with a healthy lifestyle and of course learn to balance your emotional side because it is not only food, it's not only the disease, but it's also the emotional stress that would lead you to the different or might be in a specific type of digestive system disorder. Now let's go first for number one, which is the liver cirrhosis. It is said that this is an irreversible scarring of the liver and loss of liver cells. If you're going to look at the picture here, you can compare the healthy liver versus the liver with cirrhosis. So you will see the physical difference of the two. With a healthy liver, you get a smooth surface, while for the cirrhotic liver, you will see bumpy nodules. The causes of liver cirrhosis are the following. Excessive alcohol consumption. I know that some of you are already engaged in drinking alcohol, but we need to know, and you need to know, that it must be taken into account for moderation. Meaning to say, just drink less, just ample as to what your body needs. Viral HEPA B and C. Since this is acquired through a virus, it can also cause liver cirrhosis. And if you have a fatty liver, then maybe somehow it could also result to liver cirrhosis. Another cause is the parasitic infections, where parasites or organisms are trying to in-house in your liver. And then there will be infection that would cause the scarring of your liver. Another is reaction to medications. We all know that most of the time, or maybe sometimes, we have friends or family or relatives which are having allergy in taking medications. So possible, this could also result to this type of disorder. And if you are also prolonged with exposure to pollutants, environmental pollutants like the air, water, and the like, then you could also possibly acquire this type of disorder. Now, when will you know that you have this type of disorder? So we can look at the symptoms. First is abdominal pain or some stomach pain. Might it be upper, middle, or the lower part of your abdomen. The next one is bleeding and bruising. It can occur in your liver itself. Nausea, when you see the world is turning around, it is nausea. And vomiting, that means you need to let your food out from your stomach. You can also have itching, which you can experience in your skin, loss of appetite, meaning to say you don't like to eat. Then, if you're going to look at the color of your palm, then if it's not reddish, then you're just okay. While if you're going to look at your palm and then it's having redness, then we can say that this is just one symptom. You can feel weakness, you don't want to work, you just want to lie down. Then you will notice excessive hair and weight loss. Hair loss is somehow natural, but if this is already excessive, so maybe you need to be alarmed. Then you will have the yellowing of skin or jaundice. So, what are the diagnoses for liver cirrhosis? One is medical history. Go to the nearest hospital and have physical examination, or you can have blood test or liver biopsy. When you say biopsy, this is a procedure done in the clinic or in the hospital wherein they need to take a tissue out from your liver so that they could examine that. And then we also have image scanning, just like MRI, X-ray, and CT scan. Now, how are you going to treat a person with liver cirrhosis? There's only one way, through liver transplant. Next is peptic ulcer. When you say peptic ulcer, this is a painful sore on the linings of the stomach or in your duodenum. When you say sore, these are somehow like wound. Just like in the picture, if you're going to see here, there's a certain portion of your stomach which you can see a circular portion here, and then this is a sign that you can have different types of ulcer, maybe just the first stage of ulcer, but if this comes to complexity, then you will see that in your stomach it will form holes, and these holes are of course inhibited by the Helicobacter pylori type of bacteria. Now, what are the causes of peptic ulcer? One is the regular use of painkillers. Non-steroidal anti-inflammatory drugs are also known as NSAIDs. So, for example, if you get a headache, even if you can still endure the pain, you automatically take in different types of painkillers like aspirin, ibuprofen like medical, biogesic, and naproxen. Smoking and drinking alcohol can also lead to peptic ulcer, and it can be caused also, just like what I have said, a certain type of bacterium called Helicobacter pylori. What are some of the symptoms of the peptic ulcer? One is the burning pain in the middle or upper stomach between meals or at night. So whenever you're going to eat, you're going to feel the pain as the food passes through or going to your stomach. You will also have gas pain, bloating of stomach, meaning to say your stomach will get bigger, and then you will also have heartburn wherein the acid will go up. Then again, you will experience nausea and vomiting. What are some of the diagnoses for the peptic ulcer? One is the Helicobacter pylori test, endoscopy, wherein there is a certain machine with a camera which is attached in a tube, will be placed inside your mouth, going to your esophagus down to your stomach. Then it will capture everything that is going on in your stomach. And then you also have X-ray. The treatment for peptic ulcer, of course, you need to have healthy lifestyle, taking medication, and undergoing surgery. When you say healthy lifestyle, that means, of course, you need to eat foods that are nutritious like fruits, veggies, and then taking medication, appropriate medication subscribed by your physicians. And then if you cannot help it anymore, then you need to undergo surgery. The third type of disorder is the gallstone. Gallstones may develop when cholesterol and other substances in the bile form crystals that become hard stones in the gallbladder or bile duct. As you can see in the picture that I am pointing, these are some examples of gallstones. But in the earlier stage, gallstones are just like sand. But as days or years passes by, if there are no treatments, then it will form into like pebbles. What are some causes of gallstones? One is your diet. If you keep on eating food rich in bad cholesterol, then you may acquire this one. Another cause is body weight. If you are obese or if you have an excess weight and then you have difficulty scheduling yourself for an exercise and the like, then of course it's possible you can acquire gallstone. And it can also be through heredity or genetics. What are some symptoms of gallstones? One of the symptoms are severe upper abdominal pain. So upper part of your abdomen, you will feel pain, then nausea, vomiting, and of course you will have high fever. Diagnosis of gallstones are the following. First, medical history. So go to the nearest hospital where you usually go and then try to trace back your medical history. We can also have blood and urine examinations, imaging like MRI or ultrasound. The only treatment for gallstones are just the following: have medications and surgery. Now the last part or the last disorder that I will be talking about is constipation. As you can see in the picture this side, the second one, it really depicts on what is really the scenario for constipation. Now in a week there are 7 days, but if you only defecate less than 3, then maybe that's a sign that you have constipation, wherein you will have stools that are dry, hard, and difficult or painful to pass, that it will take you even half an hour to let the feces out of your body. Now, what are some of the causes of constipation? One is not drinking enough fluids. So I am emphasizing here fluids. So you can have water or juices. It could be fruit juices that might be helpful in your digestion and of course will help you in your bowel movement. And then not eating enough fiber. Some examples of fiber are cereals, fruits, and green leafy vegetables. And then sudden change of lifestyle. For example, before you are fond of eating vegetables, but right now, mostly every day, you keep on eating meat like pork, beef, and chicken, then it could also contribute to constipation. Another is that it could be a side effect of certain medication, anxiety or depression and stress. Okay, now for the diagnosis, it could be again through medical history, physical examination of the rectum, wherein you need to see a doctor and the doctor will let you perform inside a laboratory or inside a hospital, wherein the doctor really needs to see your or examine your rectum physically. And then you will have blood or stool examination rather, and endoscopy. Again, a camera will be inserted to your anus going to your rectum to see what's going on. And then the treatment is laxative. When you say laxative, it could be food or medication that would somehow soften your feces. And then it's also advisable that you need to drink up to 8 glasses of water. Then eat lots of fiber, and then you need to exercise to feel better. Now I have completed the 4 types or 4 common disorders of the digestive system. I hope you understand our lesson for today. So by this time, you will answer the first activity. You need to answer this one directly in a 1/2 crosswise of paper. There are 5 questions. You may revisit or replay the video so that you can answer this. So let me read the questions. Number 1, what are the symptoms of cirrhosis of the liver? Number 2, what kind of drug causes peptic ulcer? Number 3, how do gallstones develop? Number 4, what causes constipation? The number 5, how can digestive disorders be avoided? Take notes, students. You need to answer all the questions in a complete sentence. So this is your first activity, good for Friday. So expect for another 5 activities that you need to answer so that you can cope with the days that you missed here in school. Thank you for listening, and I hope you have learned something even if you are not in the classroom. This is Miss Tabliga saying, have a good day and enjoy. God bless.